Okay, this is a model of the spine, and the spine is made up of 24 vertebrae, and then the sacrum and coccyx down here. So 26 bones of the spine altogether. Each of the vertebrae of the spine is open in the middle to allow the spinal cord to run down the center of the spine, and the bones of the spine help to protect the spinal cord. The nerves branch off the spinal cord, and they come out the openings between the bones on the sides of the spine here, on both sides of the spine. And then each vertebrae in the spine can move independent of the bone above and below it because they have these 4 joints on the back that they share, and then the 2 joints in the front where the discs are. So those 6 joints allow for that bone to have movement, and each of these joints is aligned with a nerve. So this joint and this joint line up with that nerve. So if something happens to these joints, if that vertebrae gets out of alignment, it can cause pain and irritation in the joint, and that can irritate the nerve. Or if you have a bulging or herniated disc, that can push out and press on the nerve as well. Now, if we look at the spine, at the picture here, if this joint was out of alignment and it was stuck and was causing pain and swelling and inflammation in this joint, that can irritate the nerve. And if the nerve becomes irritated, typically it becomes overactive. So if the nerve is overactive and painful and it's going to your stomach in this case, it could cause you to have an upset stomach with some mid-back pain. That nerve also goes to some muscles and skin. So if the nerve is irritated and painful and it's going to a muscle, it's going to cause the muscle to get tight, and it'll be tight and achy. And then the part that's going to the skin for a sensation, if that's irritated, it can cause that tingly, prickly feeling, burning sensation, or pain. Now, if the situation was such that there was a bulging or herniated disc pressing on that nerve, pinching the nerve, instead of that nerve being overactive, it would be underactive. So that would cause the function that's going to the stomach, instead of the stomach being overactive and upset, it would be underactive, and you would feel bloated and full when you eat a small meal because your stomach wouldn't be functioning very well. And instead of the nerve that goes to the muscles being overactive and causing the muscle to get tight, the signal would be decreased going to the muscle, and it would cause the muscle to have weakness. And then the part that's going to the skin for a sensation, instead of that being tingly, prickly feeling, it would be more of a numbness type of situation. So if the nerve gets pinched, you're going to feel more numbness. If it's just irritated, it's going to be more of a pain type of symptoms.